Hello and welcome to yet another edition of COVID-19. I'm Min Son-hee. The World Health Organization has highlighted the severity of the situation across the globe as countries continue to battle the virus. Here in Korea, authorities have raised social distancing guidelines to level 2 and have now declared the guidelines mandatory. We start the program now with the latest numbers on the pandemic with our Kwon So-ah and related news with our Kim Mo-gyun. So, how many infections has Korea recorded for this Wednesday?
Well, we have almost 300 new infections, Sunny, and it looks like this week we may have to brace for further increases, especially due to church-linked cases in the metropolitan region, and which is also why the government yesterday raised the social distancing measures to level 2 in Incheon, in addition to the capital Seoul and Gyeonggi-do province, and called on the ban of any in-person religious services in the greater Seoul area. And more on that we will hear from our Kim Mo-gyun. But first, let's take a look at the figures this Wednesday. As I said, almost 297 new cases, and this is the highest figure since March 8th. The death toll remains at 306, but the concern is that many of the church-linked cases, many patients are above the age of 60, which means the number of people in critical or serious condition is expected to rise. We have 225 people more in quarantine and 72 new recoveries. Meanwhile, the total accumulated figure has surpassed the 16,000 mark, and also recoveries have exceeded 14,000. Now, most new cases this Wednesday were reported in and around the capital, 151 in Seoul, 99 in Gyeonggi-do province and 8 in Incheon. We also have 6 cases in Gwangju and Gangwon-do province, and also 9 here down south in Busan. And as you can see, almost all provinces and districts are being affected. Now let's go over to our graph. We are seeing quite a gradual increase in cases, and now 297. This means we have a 5.5 on-week jump compared to last Wednesday.
So, back on the international, well, not back, but then on the international front, I understand the WHO has expressed concerns regarding the so-called vaccine nationalism. Tell us more.
Right, Sunny. WHO Director General Tedros Adhanom Ghebreyesus called on the international community to join a global vaccine agreement, which should be drafted by the end of this month, and aiming to prevent hoarding of vaccines. He stressed sharing supplies strategically and globally is also better for each country's national interest. So as we are waiting for a vaccine, the numbers across the world are still on an increase. As of noon Korea time, we have 22.3 million total cases, over 784,000 deaths, and 15 million recoveries. Now let's go over to the hotspots across the world. We have the US and Brazil, which are seeing daily cases, new daily cases between 40,000 and 50,000, but India again has more than 65,000 new cases, bringing the total to 2.76 million. And meanwhile, South Africa here at 592,000 is slowly approaching 600,000. Let's move over to our next table. Here, a concern in countries down here, Spain, Iran, and the UK, which are places where the pandemic has actually kicked off pretty early in the year. These are all seeing resurgences in cases, with daily cases at above 1,000 or even 2,000. And those are the updates I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Now, as our Kwon So-ah has mentioned, Korea is tackling a fresh outbreak, one that has called for tougher prevention measures in recent months. For more on the domestic developments, I have our Kim Mo-gyun here in the studio with me. Welcome, Mo-gyun.
Good afternoon.
Mo-gyun, let's start with details on the cluster infection at a church in northern Seoul.
Sure. At least 500 people have been confirmed to be linked with the country's second largest cluster infection in Sarangjeil Church, which is located in Seongbuk-gu district in Seoul. The pastor of the church, named Jeon Kwang-hoon, is a vocal critic of President Moon Jae-in, and he tested positive for the virus on Monday. He was in the hot seat after attending a mass anti-government rally held at Gwanghwamun Plaza in central Seoul on Saturday, along with scores of his worshippers, which authorities claimed was in violation of administrative orders. Authorities have failed a lawsuit against Chun, which includes a charge of spreading false rumors about the outbreak and ignoring orders to self-isolate. President Moon blasted church members who followed Chun to the rally, saying they had taken part in a, quote, unforgivable act and threatened people's lives. Aside from the cluster infection at Sarang Jail Church, another cluster at the Uri Jail Church in Yongin, Gyeonggi-do Province have also infected at least 140 people.
Right, Mo-kyun. How are medical experts assessing this latest situation here?
Well, experts say that there could be other reasons that contributed to the sudden rise recently. With many people in their summer vacation holidays, we may continue to see high caseloads as people travel about. Also, the growing number of silent spreaders are fueling concerns that people could be traveling around the country and spreading the virus unknowingly. A medical expert says that in order to control the situation, the government should make sure people continue to abide by strict disease prevention measures.
People have been complying with the words of experts and wearing masks as well as keeping social distancing, but they have become more casual about it. The government's efforts to boost consumption might have also sent the wrong signal, so it is important to return to the original goals, especially during the holiday season.
Right. I understand the government is also looking into the possibility of further strengthening its social distancing measures, Mo-kyun.
Yes, Prime Minister Chung Se-kyun said that this week will be a critical juncture which will determine how things will unfold from here on out. We're just coming off a long holiday weekend and additional cases could be reported as more people get tested throughout the week.
We are at a critical crossroads where, if we don't get the situation under control, this could rapidly lead to a bigger outbreak across the country. The government has decided to further strengthen social distancing in the capital area to quickly stop the spread.
Now, under the new measures effective as of today, the government decided to maintain its social distancing level to stage 2, but with additional guidelines for Seoul, Gyeonggi-do Province, and the city of Incheon. It calls for a ban on all indoor gatherings of more than 50 people and outdoor gatherings of more than 100. All places of worship are prohibited from holding religious services in person, and in addition, some public facilities such as museums, libraries, and parks will be shut down. 12 types of high-risk facilities will also be shuttered as well. Most of these facilities, including bars and clubs, have been closed already for a while. But now, gyms, singing rooms, buffet restaurants, and PC rooms will have to suspend their operations as well.
Right, that's quite a long list. Morgan, I hear the corporate sector is also doing its part in accommodating the government's containment efforts?
Yes, as part of efforts to help the government in their preventative measures, private companies have also now allowed their employees to work from home. On Tuesday, major IT firms, many of which briefly adopted work from home policies and flexible working hours in late February, are allowing their employees to stay at home. Kakao, the operator of Korea's leading mobile messaging app KakaoTalk, had said that all of its employees have been allowed to work from home as of last Friday, and the country's top internet portal operator Naver also began partial work from home arrangements starting last week. Gaming giant Nexon made a similar move, ordering its employees to show up to the office only twice a week. And leading mobile carriers SK Telecom and KT said they're enforcing a teleworking system until August 23rd. And meanwhile, the National Assembly Secretariat is also pushing for legal revisions to allow remote voting on bills in case the parliament sessions are canceled due to COVID-19. Usually in South Korea, lawmakers are physically present at the parliamentary chambers to cast their votes, but the Secretariat is pushing for new amendments to allow members of the parliament to hold video conferences and vote online. The office says the system will be crucial in passing urgent bills, claiming that the U.S., England, France have already adopted similar measures.
I see. All right, Mo-kyun, thank you for that report. I hope to see you again soon.
My pleasure.
Right, up next, we bring you the afternoon briefing on COVID-19. Now, as alarming as the latest outbreak is, the reality is that the resurgence is a global trend at the moment, and one that had been forecast by authorities here to occur in the months of autumn. The early start now has health officials here working around the clock to contain it. And as part of efforts, members of the public in Seoul, Gyeonggi Province and Incheon are now obliged to abide by all guidelines under level 2 of the social social distancing guidelines. The briefing has started. We'll come back to you afterwards.
Let us now begin our regular briefing for August 19th, Wednesday. As of today midnight, we have 283 new local infections and 14 new imported cases. The total caseload now stands at 16,058. And 72 more people have been discharged following full recovery, while a total of 1,746 people are in quarantine. And there are 12 people under severe or critical conditions. There were no additional fatalities. And let us now look at the major updates on our domestic infections. As of today midnight, we also have some numbers subject to change, so please understand the situation. And starting from the Sarang Jail Church in Seongbuk-gu District, Seoul City, we are conducting tracings, and a total of 166 people have been confirmed additionally, and a total of 623 people have been confirmed. A total of 588 people are clustered in the metropolitan area, including Seoul City, Gyeonggi-do Province, and Incheon City, and there are about 35 people in non-metropolitan areas. In relation to this church, we also have many offices and residences. The offices including call centers, nursing hospitals, and other churches. We have seen a very wide range of chain transmissions. And we have confirmed that in 114 offices and buildings and facilities, including 4 call centers and 5 religious service centers, and 7 kindergartens and daycare centers, and 33 schools and private academies are under such chains of transmission. As of 6 p.m. yesterday, we have confirmed that out of the 114 facilities that have been chains of transmissions, 111 of them have seen great further transmissions, with about 50 cases so far. And we also have many other facilities that have spread stemming from this church. And as for the Sarang Jail Church, we also had heard rumors that all of the worshippers are their test results are manipulated to have positive results to the PCR testings. But please note that these rumors can be worrisome, and our test results cannot be manipulated and for any specific individuals. And we also advise all of the people who have visited this specific church since July 27 to get tested as soon as possible, irrespective of whether they have symptoms. And please comply proactively with our quarantine measures. And here are other updates on our domestic infections in Seoul, Yeongdeung-gu District, Hyundai Commerce, and in relation to a Daegu family in Suseong-gu District, we also have one additional one index case, and a total of 12 more people have been confirmed. In total, we have 17 confirmed patients. Next, in Seoul, Gwanghwamun, in relation to the Liberation Day rally, we have seen the first index case on the 18th of August, and 9 more people have been confirmed. A total of 10 people have been confirmed to date. And by classification, there are 2 from Seoul, 2 from Gyeonggi-do Province, 2 from Incheon, 1 from Chungnam, and 1 from Jeollanam-do as well. And we have identified that there are also many people who have not been in relation to the Sarang Jail Church among the confirmed cases from the rallies, and we have seen signs of transmissions through the rallies. And in order to take preemptive measures, we are asking all of the people who have attended the rallies at the Gyeongbokgung Palace on the 8th of August and the Gwanghwamun Plaza rally on the 15th of August to get tested as soon as possible, regardless of your symptoms. Moreover, in Yeongdeung-pogu district in Seoul, we have the Yeouido Sunbogum Church. We have 3 additional cases being confirmed. In total, we have a total of 7 cases now. And in Gyeonggi-do province, in relation to the Uri Jail Church, we have confirmed that 7 additional cases have been confirmed, and a total of 154 people have been confirmed to date. And in relation to Starbucks in Paju City, Gyeonggi-do province, we have 6 additional cases being confirmed. A total of 55 cases have been confirmed to date. Moreover, in Gwangju City, in relation to the nightlife entertainment venue in Sangmu-gu district, we have additional cases, 2 additional cases, and a total of 19 cases have been confirmed. We also have 14 imported cases today, and as for the countries, 4 are from the US, 3 from Kazakhstan as well.
저희 중앙방역대책본부에서는 렘데시비르를
The KCDC has administered remdesivir to 135 patients at around 35 hospitals nationwide. And here are some updates and messages for our live quarantine measures. In the metropolitan area, we have issued the level 2 social distancing measures, and we are asking all of the residents in these Greater Seoul area to strictly abide by the quarantine measures. And we ask you to refrain from making non-essential visits outdoors, excluding those to the offices as well as to health clinics. And in relation to dining, please do not visit restaurants or cafes, but utilize the delivery service and takeout as well. And instead of going to indoor gyms, please work out from home. And instead of meeting for gatherings, please also meet via online through your PCs and your mobile phones. Even when you have to make outdoor visits, please wear face masks when you are indoors. And even when you are outdoors, if you cannot keep 2 meters of safe distance, please wear your face mask at all times. Having 2 meters of distance, and even when keeping 2 meters of distance, the actions and behaviors that increase the respiratory droplets travel, including chanting and shouting and so forth, shall always be prohibited. And please refrain from handshaking or giving hugs, and also refrain from going to the crowded, closed, and close contact environment completely. And more specifically, if you have symptoms like fever and other respiratory symptoms, do not go to work, do not go outside, and also consult our call center and visit the screening clinic as soon as possible and get tested. And aside from the other areas, aside from the metropolitan area, which are not under the level 2 social distancing measures, we are also noting that we have a risk of a nationwide possibility of spread of the virus. And please abide by the quarantine measures as well on the same level of the level 2 that is issued in the metropolitan area. And starting from the 19th midnight, we also ask all of the face-to-face meetings at churches to be banned, and we will also have administrative order to place a ban on all of small gatherings as well as group meals at churches. And we ask all of the churches in these areas to refrain from meeting and having face-to-face gatherings and services. And please also refrain from organizing retreats and go outside the metropolitan area as well. And we are also seeing great risks of infections among churches as well in other regions as well. So we ask all of the churches nationwide to also comply with these similar measures and hold non-face-to-face gatherings and services and switch to online means. And last but not least, today we have a total of 297 confirmed cases, and in just less than a week, we have over 1,000 cases. And this also is an evidence that shows that local transmissions have begun starting from early August. If we fail to contain the virus at this moment, this also shows that the virus can spread at any time across the nation. And yesterday, we have issued the social distancing measure level 2 to not only Seoul and Gyeonggi-do province, but
also intensity, and we ask all of the residents living in these areas to refrain from making non-essential outings as well. And we are also exerting our full efforts to track down all of the members of the 사랑제일 Church. And already through these confirmed cases that have been stemming from the 사랑제일 Church, we have seen a widespread and transmissions, chain transmissions, and our utmost priority now lies in cutting these chains of transmissions. First of all, we believe that the first crossroads is this week until the weekend, and we believe that even if we have an increase in number of the confirmed cases up until this weekend, if these are most of them are related to 사랑제일 Church, it proves that our quarantine measures are effective and are successful. However, if we have more cluster infections that are not linked to the 사랑제일 Church, it will also testify that the local transmissions are spreading even faster and even wider. So we are also very much worried about silent spreaders spreading through nationwide. And once again, I would like to highlight that all of the worshippers and church members, the visitors, as well as the contacts who have been coming to contact with these church members, as well as these attendees who have attended the rallies on Liberation Day at Gwanghwamun District, we ask you to get tested as soon as possible. Fast and swift testing would help save not only your lives, but also protect your loved ones and your friends and your other neighbors from the disease, and to prevent a greater social loss as well. This is a century, it is a health crisis that comes in a century, and it is a global crisis, and our government is also standing at a cross point in saving the lives of our public. And we believe that the test results of the PCR testings cannot be manipulated, and we once again highlight that it is impossible for the authorities to intervene in the decisions of the diagnosis by the doctors and medical staff. And please refrain from spreading false rumors, and also refrain from evading from your self-quarantine areas. And we believe that these hindrance to the quarantine measures rather put at risk the safety and health of our members of the public. And please cooperate proactively to the quarantine measures as well. And once again, we have some restrictions on the daily routines of our public. However, please note that these toughened measures are put in place in order to prevent the lives of many other people within our public. And please refrain from going outdoors and always wear face masks. And probably the effects of the social distancing measures that we take right now will yield results in late August and probably in early September as well. We ask for your consideration. Thank you very much.
Right, that was Kwon Jin-wook, the Vice Head of KCDC, with Wednesday's afternoon briefing. Suha, to give us a summary of that briefing.
Sure. Well, Kwon said this week is really crucial in deciding whether this current situation is going to become an even more severe crisis or not. And that is why contact tracing and getting tested for the virus is important, especially as we have some 166 new cases related to this Headquaters Church in the capital Seoul alone. So 623 cases are now in total linked to that church. And then there's also secondary transmissions at call centers, more than 40 workplaces, medical facilities, welfare facilities, as well as academies and schools as well. And Kwon also had a remark on groundless rumors that every 사랑제일 churchgoer tests positive for the virus, stressing that manipulation of test results is impossible. And last but not least, he again asked for the nation's people to comply with the social distancing measures, which are at level 2 in the metropolitan region, including in Incheon now. And beginning today, only non-contact church services are allowed. 12 high-risk facilities are closed, and also people should not gather and refrain from non-essential outings.
All right, so thank you for that. We'll see you again tomorrow.
See you tomorrow.
Meanwhile, in Germany, researchers there are hosting a concert at an indoor stadium this coming Saturday to study the spread of COVID-19. For more on this rather intriguing experiment, I have Professor Michael Geckler from Martin Luther University Halle-Wittenberg live on the line. Welcome, Professor Geckler.
Yeah, welcome and good afternoon to Seoul.
Right, Professor, perhaps you could start with details about the experiment. I understand the concert will be held indoors featuring an actual German pop singer. Please tell us more.
Yes, that's true. So the concert is part of a major project. So the project started in June and will end in October. And it's about evidence-based risk assessment for cultural and sports events, because we believe there is no real zero risk scenario if you want to keep cultural and sports event alive. So what we do is we generate a mathematical model of this venue, of the transport to the venue and of the event under pre-corona conditions. And then we identify hotspots or special risk conditions. And then what we need after these in silico prediction, we need real live data. And in order to obtain real live data, we will have the concert on Saturday, where we will track all the contacts of the visitors, how many contacts, how long the contact is, how distant the contact was. We will monitor the traffic to the arena. We will monitor the airflow by measuring CO2. And then we have real world data. And with these real world data, we go back to the mathematical model, and then we will have a more valid mathematical model. Because at the end, the purpose is to estimate the risk such an event means for a metropolitan area of about 1 million people. So what does it mean if you organize a concert under certain corona conditions? With how many infections do you have to calculate? What does that mean for quarantine and for hospitalization? So that the authorities are able to perform an informed risk balance analysis.
Professor, how did you manage to secure government approval for the experiment? I mean, Germany in recent weeks has seen an average of more than 1,000 daily cases compared to just about 350 in early June.
Well, our state governments are rather enthusiastic, and they support and even fund the project, because for them it's clear, of course, we have to fight corona. But on the other hand, we have to guarantee the people a certain social and cultural life. Otherwise, the society will not follow the measures to fight corona any longer. And so there has to be a good balance which the population is ready to accept. And for that, the government is really eager to receive our results.
The people who participate in the concert are volunteers, am I right, Professor?
Yes.
I see. What preparations do they need to go through before they join this concert? I ask because here in Korea, one of the most recent cases involves a coffee shop, an indoor coffee shop, of course, that led to more than at least 55 related cases. And health authorities are linking this to absence of face masks, poor sitting arrangements, as well as poor ventilation.
Well, we will test all participants 48 hours before the event. All the participants will wear FFP2 masks within the venue, and we restricted the age of the participants to under 50 years of age. So in any case, which we believe will not happen, but if there in any case anybody will be infected, the clinical risk is really low.
Professor, tell us what happens once the concert is over. How are the results drawn up then?
Well, the results, we have the personal trackers. So every participant has a tracker. So we monitor the movements, the contacts of all participants individually. Then we will also measure the airflow and the CO2 flow as a surrogate parameter for aerosol distribution. And we will also monitor surface contacts of the visitors. These data will then be integrated into the mathematical model. And then we will have a true scenario, what happened and what the risks are. And then we will try to identify measures to reduce the risk. And we will also have 2 scenarios on Saturday, or maybe even 3. So we will have a first scenario of a concert that was organized in the pre-corona era. And then we will have a second scenario where we already implement measures, corona measures, like organizing a different procedure at the entrance. And then we will also compare the 2 scenarios. Is the number of contacts reduced? Is the distance of contact reduced? Can we really reduce the risk by these measures? And then we will deliver these results to the authorities, and we will hope that it's helpful for them.
Okay, well, once again then, the gist of the experiment therefore, Professor, is to study the spread of COVID-19. Why would this experiment be important?
This experiment is important for the authorities to decide under which conditions they will allow events like this to take place. Because the authorities, well, they could go for a zero risk management and prohibit all these events for we don't know how long, we don't know when the vaccine will come. Or they could go for an informed risk-benefit analysis and say, well, if there is a tiny risk of some infections, it's nevertheless worthwhile to have this concert take place. And the authorities need real, valid scientific data to go for this evidence-based risk management.
I see. All right, Professor Geckler, thank you very much for making the time to join us live at this hour with your thoughts, and good luck with the concert in Leipzig this Saturday.
Thank you very much, and bye-bye to Seoul.
이번 수도권 유행은 지난 신천지 유행과 달리 바이러스의 전파력이 높은 GH형일 가능성이 큽니다. 지난 2, 3월의 신천지 집단 발생 당시보다 훨씬 더 큰 위기라고 판단하고 있습니다.
Korea is battling a fresh wave of infections, and authorities are urging members of the public to abide by containment efforts, as prevention is better than cure, especially in the absence of such a treatment. And on the subject of treatment, how far have researchers come in the race for a vaccine? To answer this question and more, I have Dr. Jerome Kim, Director General of the International Vaccine Institute. Welcome, Dr. Kim. And I also have Dr. David Kwak from Suncheonang University Hospital. Good to have you back, Dr. Kwak.
Good afternoon.
Dr. Kwak, infections that started at a conservative church in northern Seoul have now spread beyond the capital city into different corners of the country, as well as different venues, including nursing homes, daycare centers, and even military bases. How severe is the latest situation?
Right, I could say that this is exactly what everyone was afraid of when we were planning to step down a national measure from social distancing measure to daily life distancing measure. We were always talking about amidst of all this, one single untraceable case can cause a huge cluster infection, and suddenly there can be an explosion. That is exactly probably what we're facing right now. So from these 2 certain groups and many other sources of actually untraceable cluster infections, we are already seeing possible secondary and tertiary infections spreading out to other people as well. So we really need to brace ourselves and see how this will end. Of course, it's going to stay, the numbers are going to stay within the hundreds of confirmed cases for a little while. But hopefully, if we can really go back to strictly social distancing and really keeping the measures for ourselves, hopefully we'll go back down to the 10s and 20s that we were seeing before.
Right. Dr. Kim, how do you assess the current outbreak here in Korea?
So I think, as the previous speaker said, it's serious. It has the potential to escalate to very, very dangerous levels that would potentially threaten to put Korea back where it was in March. It is expected because I think we haven't gotten rid of the COVID problem. It remains a threat, and it will continue to spread through outbreaks just like this one, or like the one in Itaewon earlier. I think it emphasizes, it reaffirms the need to be vigilant, and also the government's approach, which has been testing, tracing, isolating those who need to be isolated, and treating those who need to be treated. It really gets the idea that if Korea is to stay open, if they can maintain economic activity and some measure of daily living, then that is the trade-off that has to be made while we wait for a vaccine.
Right. Dr. Kwak, health authorities claim that this particular week is crucial in determining the future path of the current outbreak. Please explain this to us.
Well, it's as the KCDC just mentioned today, we have the numbers that we're currently seeing are quite possibly from the beginning of August. So we are not tracing back just a couple days ago. We're actually looking back at 2 weeks or 3 weeks back that these confirmed cases are coming up from. And on top of that, we've also had a long weekend over the past week. And we've seen people going to beaches, going to travel sites, and they were gathering very socially. So that's what becomes very worrisome in respect to keeping social distancing measures, basically. So this will be a very crucial time to mitigate the virus. If we don't keep a more strict version of the measure, then will be a possibility that it can even spread further into greater numbers of confirmed cases. So this will be a critical time that we all, as a whole nation, gather ourselves to really not come into contact with anyone else if as long as it's unnecessary, and try to mitigate the virus.
Right. Another thing that health experts have touched upon, Dr. Kim, is the reality that the spread of the virus at this particular moment is very high. They've also said that compared to our spread during the Shincheonji outbreak, the one at the Conservative Church in Northern Seoul is quite severe because 1 out of 4 of the members of the church there have tested positive so far. Mm-hmm. Would you link the rapid rate of transmission to perhaps the mutations of the virus in recent days?
So it's difficult to say. The mutations I think are very interesting. They're interesting biologically. We understand that, at least in a test tube, that it appears to be more easily transmitted, and it looks like that strain has taken over the transmissions in various parts of the world where it's been introduced. So it is more easily spread on the one hand. The only piece of good news here is that it doesn't appear to be more lethal. And that may be important, but when you look at the number of changes in the virus, if you imagine the number of changes in the coronavirus as the head of a pin, something the size of my finger would be the number of changes in a single year with influenza virus, and with HIV, it would be the size of my hand. So by comparison, the number of changes, mutations that occur with the coronavirus, at least to date, and I think we've sequenced over 50,000 full genomes, it doesn't appear to be that great, maybe 6 or 7 individual changes out of 30,000. So it's, again, maybe good news that it doesn't mutate itself very quickly.
I see. The strand that people believe to be more infectious, or 6 times more infectious, is the GH clade, right? I see. Dr. Kim, what implications do mutations have on the quest for a vaccine?
That's the million-dollar question. And we have some information now from some monkey studies. And in particular, they vaccinated the monkey with one of the new vaccines. It's actually based on one of the original strains of coronavirus. And 12 weeks later, they challenged that monkey. That monkey was protected, which is good news. The other thing is, though, they tested the blood of the monkey to see if the blood produced infection-fighting proteins that bind to and neutralize the virus. And in fact, it neutralized both the old strain and the new strain. So that, again, may be some potentially positive news, that the current set of vaccines will cover at least this mutation. We don't know how it will do for future mutations.
Well, that's still good to know, though. Dr. Kwak, over the past 2 weeks, we've had a number of cases, a rise actually in the number of cases that cannot be or could not be traced. Out of 1,126 infections, we had 131 cases which authorities could simply not trace. What meaning does this reality have on containment efforts?
Well, it's obviously bad news. The percentage, if we calculate, of the untraceable confirmed cases, is actually on the rise, and I believe has risen to almost 12% now. That's something that really we have to focus on in mitigation of the virus. If some of the cases are traceable, we can go directly there and let them be self-quarantined or isolate them physically. But for untraceable cases, it's coming out of nowhere. So we really have to put all our efforts into mitigating and minimalizing that particular number in regards to the whole number of cases.
Dr. Kim, about a week ago, Russia registered the world's first vaccine against COVID-19, much to the skepticism of its global counterparts. What are your thoughts on this particular vaccine?
So I think that we have to be very careful about vaccines. The Korean people around the world have enormous confidence in the current set of licensed vaccines, approved vaccines, because they've been shown to be safe and effective. When we make summary judgments, when we move without information, without the science that backs things up, then we are potentially, threatening the lives of the volunteers, but also the people who, believe that something that they're receiving from a government or from a health clinic is safe and effective and has been shown to be safe and effective. So, we have to really base everything on science. And so I think it's possible that this Russian vaccine will work, but they should show everyone the data. And at this point, they've only started human clinical testing, so they don't have that data. So rushing to a summary approval, to a rapid approval is actually kind of dangerous. And we really should, and I think most governments, really base the licensing of vaccines on an international standard. There's an international standard of quality and efficacy, and everyone reviews the same safety information and efficacy information so that we know that a vaccine, when recommended, when approved by the government, is safe and effective. And that's the key.
Dr. Kim, are we also having enough discussions on the fair distribution of a vaccine once it is available?
That is a very difficult question. So the first thing you have to do with a vaccine is prove that it's safe and effective. And the second thing is to make a lot of it. And the third part, which is often the most difficult, is ensuring that that vaccine is accessible to populations all over the world. So your question is well timed. Right now, as we speak, 150 countries are trying to hammer together some sort of agreement to provide up to 2 billion doses of vaccine to make it available to the world by the end of 2021. It seems like a difficult target, and it will be, and it will require a lot of compromise, because you'll have to secure the vaccine, you'll have to actually put it into vials, then you'll have to distribute it all over the world, and getting the agreement is going to be critical. So the government of Korea has actually signed on to this effort called COVAX. It's going to be very important. It's critical for parts of the world that can't afford to pay more for vaccines or can't make special deals with vaccine companies. So I'm hoping that COVAX succeeds, and the groups that are putting COVAX together are working very hard to try to ensure that everyone is included and that at least 20% of their vaccine needs are supplied. That would cover the elderly and healthcare workers as a first pass, potentially the most vulnerable population. So again, there's a lot of work to do.
Right. Dr. Kwak, back here in Korea, authorities are urging people who believe they may have been exposed to the virus to get themselves tested. Now, please tell us, when do you believe that the belief that you are possibly infected, when does it become valid?
One peculiar thing about this virus is that it covers so many different symptoms. But usually we see a lot of people coming up with agitations in the throat. Some people can actually go further to have sore throat, but before it becomes painful, people would usually show phlegmy throat, or having to clear their throat a lot. Also, some other people have shown runny nose. Some people also have shown actually gastrointestinal problems, meaning abdominal cramps and stomach aches and whatnot. But obviously, if you have fever, that is a definite sign that you definitely need to go in and be checked.
I see. Well, that's the simple answer right there. Dr. Kim, what are some important safety measures for the public, members of the public, to keep in mind in the absence of a widespread vaccine?
So that hasn't changed from the beginning of the epidemic. Social distancing is the most important. When you can't distance, wear a mask. And good hand hygiene, so washing your hands frequently during the day, and then, cough hygiene if you have cough. People who are sick should stay at home. We can't emphasize that enough, because you think, well, it's just a fever, maybe it'll pass in a day. be careful, because it's those times when a person potentially doesn't know they're infected, but really is capable of spreading the disease. And we've seen this over and over again. And I think that the final part is this only works if the Korean people cooperate and work to try to prevent the spread of COVID-19 to other people. It really requires participation of society. And I think when you look at countries that have been successful and countries that haven't been successful, it's been the ability to mobilize public support behind the measures that prevent transmission.
Right. All right, Dr. Kim, thank you very much for your thoughts. And Dr. Kwak, as always, thank you for being with us today.
A pleasure.
Right, on that note, we end this edition of COVID-19. Do tune in tomorrow as we delve into the resurgence of the virus across the globe and the efforts to better contain it. Do take care until then. Thank you for being with us.